Hi, my name is Mike Wang. I'm a neurosurgeon at the University of Miami in Miami, Florida.
Hello, everybody. I am this Luke Kim, this neurosurgeon, Seoul St. Mary Hospital, Catholic University of Korea.
I'm very excited and honored and humbled to be here today with one of our international guests on Ask the Experts. I'm here with Jun Sung Kim. He goes by Luke, who is a master of endoscopic surgery, and we're going to talk a little bit about endoscopy in the spine. So, Luke, one thing that struck me as I was traveling is that it seems like endoscopic spine surgery is very popular, much more popular in Korea than the US. Why do you think this is?
I think that's going to be the one kind of survival game, yeah. So in Korea, there's most of the Asian countries, the patients want to do the non-invasive spinal surgery, right? If you open up the patient back, patient may deny the surgery, even though they severe spinal stenosis, intractable pain, no. But this endoscopic spine surgery is one of the, I think it is purely important solution for survivor.
Survival for the surgeon.
Yeah, survivor as a surgeon, right?
Explain that to me. Explain, like, if you don't do endoscopy, then people don't want to see you, or?
I cannot say 100%, but most of these patients want to do the minimal invasive surgery. I think that I can say the endoscopic spine surgery is just 1 centimeter. 1 centimeter to 5 millimeter to 1 centimeter incisions. Yeah. So actually, currently in the USA, ambulatory spine care, most important issue. But we have done ambulatory spine care already long before.
Ambulatory care.
Yeah, actually it's ambulatory spine care by the endoscope, then under the local anesthesia. We do the surgery, transforaminal endoscope discectomy and foraminotomy and the interlaminar discectomy, etc. So that's most important issues in most patients in Korea. They're gonna get the spine surgery under the endoscope basis. Yeah.
So I get it. So the patients have a certain mindset about surgery, and I understand East Asian patients are generally resistant to surgery across the board. I totally get that. But the other thing I noticed was that it seems like a tremendous amount of innovation is coming out of Korea. And by that, what I mean is that relative to the number of surgeons or the number of patients or the GDP and all that, like, it seems like the amount of innovation, or at least publications on it, coming out of Korea is disproportionate.
Yep.
How do you explain that?
It's like, can I say this, Galaxy, Samsung?
Galaxy?
Yeah.
Oh, Samsung Galaxy, the phone.
Yeah,
okay.
phone. Yeah. They're going to try to catch up the iPhone, Apple. This made a very innovative solution. Sometimes it's going to be similar one, but they try to innovate, and now it is so popular, right? So
yeah, I've always been jealous. Yeah, the Galaxy's camera is so much better, right?
Yes.
And now you have the foldable phone coming this month, I think.
Oh, great.
Yeah, from Samsung. Yeah. But in endoscopy, what do you think it is? Do you think it's that the competition is driving it? Do you think there's better technology? Do you think it's that the surgeons are trying to do something different?
One of the reasons in Korea, we have so many doctors, so many hospitals. Patient don't have to wait long time to meet the spine specialist. If you have the problems in your spine, patients go to the hospital and meet the spine specialist and check the MRI the day, and the surgery could be done in the day after.
Oh, don't tell my patients that, because they gotta wait months to come see us.
Yeah, that's why the Korean American citizens, they travel to Korea when they have the problem.
Really?
Not only spine, but others. Right?
That's fascinating. That's fascinating. So you're an expert in endoscopy, right? So I can ask you this question and not offend you. But what do you find are like the choke points? What are the problems you experience with endoscopy in your practice?
So we have this struggle to solve the choke point and the limitation. So we always step four, the two, because we have so many doctors, so you always discuss and they're sharing the information together. So that's why we have the fundamental reason for that, communication among the surgeons. When I was a junior, the senior endosurgeon like the Gonchoy and others, they always supervising me, always supervising junior doctors. When I do the endosurgery, he come up with me and hey, you're gonna do the more medial, your needle position is a little bit shallow then. Yeah.
So you have less problems, you think, because of that? Because you've worked so much longer with experienced doctors?
Yeah. So it is hard to identify. You have the many paper of the learning curve, right? So personally speaking, that kind of supervising from the senior to juniors and the colleagues together, we can dramatically, overcome the learning curve.
That's interesting, because in the US, when you're done with training, you just go practice medicine. So I think it's different in Korea, right, where you have a longer learning period. Yeah, interesting. Let me ask you one more question, which is something that's been on my mind for some time now, which is, what do you think is going to be the future of endoscopy in Korea? I mean, we know what's being done now. Like I hear about this biportal technique and all this new stuff. But what do you think in like 5 or 10 years we're going to be looking at with endoscopy?
Yeah, very excellent question. We always, we stand here, but we always see the tomorrow and the future, right? So most current important issue is in Korea, not only in Korea, to China and Japan, other Asian countries, we are trying to find the endoscopic solution for digital scoli, digital spondy, that means fusion. Yeah, in Korea, in China, in Japan, so many doctors already adopt endoscopic fusion in their practice, right? Yes. Some guys want to do the full endoscope, that means the monoportal. The other guys, they have the great success and the bipolar surgery, even the three-level fusions, they do very well, good job, the three-level bipolar fusion surgery. It's amazing.
So you think it's going to be conquering the complex pathologies with the endoscope?
Yes, that's the key we have to face now, right? So even the complex spine, like the digital scoli, most of the digital scoli and the multi-level spinal stenosis, most patients have the single or the double level, two-level pathology, right? So by the endoscope, we can treat the real pain generator, and then even though in the case of patient need the fusion and correction of alignment, we can add the percutaneous instrumentation.
Great. Well, that's excellent. Thank you for your insights.
Thank you.
Luke, it's really been good spending some time with you today.
Thank you very much. Yeah.